As a brain doctor, I'm shocked. The worst sleep position, stroke risk over 60. Most seniors don't realize that something as simple as the way you sleep at night could raise your risk of a stroke by up to 400% every year in the United States. Nearly 800,000 people suffer a stroke, and the majority happen during the night or early morning hours. What's terrifying is that your favorite sleep position, the one you've used for decades, could actually be cutting off blood flow to your brain while you rest. Doctors like me have seen patients who felt perfectly healthy, went to bed feeling fine, but woke up unable to speak, move, or even recognize their loved ones. And yes, it was triggered by the way their head and neck were positioned during sleep. This is not fear-mongering, it's medical reality. Tonight, I'll reveal the most dangerous sleeping position after 60, explain why it puts seniors at such high risk, and share safer alternatives that can protect your brain and your independence. Number 5, sleeping on your back without proper support. For many seniors, lying flat on the back feels natural, even comfortable. Doctors often call this the supine position. On the surface, it seems like the safest way to rest. Your body is aligned, there's no pressure on your stomach, and your face stays free. But for people over 60, this position carries hidden risks that can slowly add up night after night. The biggest concern is that gravity allows the tongue and soft tissues in the throat to fall backward. For seniors with even mild snoring or undiagnosed sleep apnea, this can partially block the airway, reduce oxygen levels, and strain the cardiovascular system. When oxygen drops during the night, your blood vessels constrict, blood pressure rises, and the brain is placed under stress. Over years, this can increase the risk of high blood pressure, atrial fibrillation, and stroke, even if you've never been diagnosed with heart disease. Research published in the journal Chest found that people sleeping primarily on their back had up to 2.5 times more breathing interruptions compared to side sleepers. For seniors whose vascular systems are already more fragile, this effect is magnified. Another problem with sleeping flat on the back is circulation. Seniors with reduced mobility often wake up with numbness or tingling in their arms and legs because blood flow is restricted. When circulation slows down, clots can form more easily, and if a clot travels to the brain, the result is a stroke. I once treated a 72-year-old patient who had no history of smoking, exercised regularly, and ate well. Yet she experienced repeated episodes of silent strokes that showed up on brain scans. The common link was her sleep posture. She always slept flat on her back, snoring heavily. Once her family added a supportive wedge pillow to elevate her head and chest, her symptoms improved dramatically. This position can also worsen acid reflux, something very common in seniors. When stomach acid flows upward during the night, it doesn't just cause discomfort, it can also trigger tiny microaspirations into the lungs, creating inflammation and further stress on the cardiovascular system. Chronic reflux at night has been linked to nighttime arrhythmias and increased stroke risk, yet most people dismiss it as just heartburn. Better tip: if you prefer sleeping on your back, don't panic. You don't have to give it up entirely. The key is modification. Use a wedge pillow or elevate the head of your bed by 4 to 6 inches so gravity works in your favor, keeping the airway open and preventing acid reflux. A supportive neck pillow can also prevent the chin from tilting toward the chest, reducing airway collapse. And if you snore, ask your doctor about a sleep study. Untreated apnea is one of the biggest hidden stroke risks for seniors. By making these small changes, you can keep the comfort of back sleeping while dramatically lowering the risks. Number 4, sleeping on your stomach-prone position. At first glance, stomach sleeping seems harmless, even comfortable for some. Many seniors grew up this way, especially those who feel it helps with snoring. But once you pass 60, this position becomes far more dangerous than most people realize. When you sleep face down, your spine is forced into an unnatural curve. Your chest is compressed against the mattress, and your head is twisted sharply to one side just to breathe. This combination places extreme pressure on the neck arteries, particularly the carotid arteries, which are the main blood highways delivering oxygen to the brain. For a younger body, this strain might only cause stiffness. But in seniors, where arteries are often narrowed by age or plaque buildup, that twisting can directly reduce blood flow to the brain overnight, raising the risk of a transient attack TA or a full stroke. What's even more concerning is the effect on breathing. Stomach sleepers often don't realize that their chest expansion is restricted. The lungs cannot fully inflate because of the body's weight pressing downward. This reduces oxygen intake, leading to shallow breathing and higher carbon dioxide levels in the blood. Over time, this puts enormous stress on both the heart and the brain. A study in the American Journal of Cardiology observed that individuals with reduced nighttime oxygen saturation had significantly higher risk of cardiovascular events, including strokes. And for seniors, the stomach position amplifies that risk because it creates both airway restriction and vascular strain at the same time. I once worked with a 68-year-old man who had been a stomach sleeper his entire life. He swore it was the only way he could fall asleep quickly. But after several months of morning dizziness, neck pain, and mini blackouts during the day, scans revealed he had already suffered multiple small strokes. The neurologic team traced it back to his sleeping position. Every night his neck was twisted nearly 80 degrees for hours, cutting circulation repeatedly. It was only after he retrained himself to sleep on his side, with proper support, that his condition stabilized. Stomach sleeping also causes hidden issues with digestion. Seniors who struggle with acid reflux or hiatal hernia often find their symptoms worsen dramatically in this position. Pressure on the abdomen forces stomach contents upward, making reflux nearly inevitable. Repeated acid exposure not only damages the esophagus, but can also trigger nighttime coughing and microaspirations that stress the lungs. It's a cascade effect. One position, multiple risks. Better tip, if you are a lifelong stomach sleeper, breaking the habit isn't easy, but small steps can help. Try placing a thin pillow under your pelvis and hips to reduce spinal strain, and use a body pillow on the side to gradually train your body to roll into a safer side-lying position. Start by falling asleep slightly tilted rather than fully fit. Over weeks, your brain adapts to the new posture. And remember, even partial changes, such as sleeping half-side, half-stomach with support, can reduce arterial compression and protect your brain. The goal isn't overnight perfection, but gradual improvement to safeguard your health. Number 3. Sleeping in a fetal curl for many seniors. Curling up on the side into a tight fetal position feels safe and comforting. It's the way many of us slept as children, and it creates a sense of security. But past the age of 60, this position comes with serious consequences for both the spine and the brain. The issue is that when you curl your knees tightly towards your chest and round your back, you compress the chest cavity and restrict lung expansion. This means less oxygen intake during the night. For an older body, even a 5 to 10% reduction in oxygen levels can push the cardiovascular system into dangerous territory. Studies have shown that reduced nighttime oxygen saturation is directly linked to a higher risk of nocturnal stroke, especially in seniors with pre-existing hypertension or diabetes. The fetal curl also causes the neck to bend forward unnaturally. This forward flexion can compress the carotid arteries at the base of the neck, restricting blood supply to the brain. If you've ever woken up from this position with dizziness, numbness in your arms, or a pounding headache, that's your body warning you about impaired circulation. One of my patients, a 70-year-old woman who had always slept tightly curled on her side, began experiencing sudden morning weakness in her right arm. MRI scans later showed she'd had multiple microstrokes. The root cause wasn't her diet or cholesterol, it was her sleeping posture, which was literally cutting off blood flow while she slept. Another hidden danger of the fetal position is spinal misalignment. Seniors often already suffer from osteoporosis, arthritis, or degenerative disc disease. Sleeping curled up places intense pressure on the lower back and hips, accelerating wear and tear. Over years, this not only worsens pain, but also affects mobility, and limited mobility itself is a major risk factor for stroke. Imagine, the very position that feels protective may be silently damaging your body night after night. Beyond physical strain, there's also an effect on the nervous system. Curling tightly stimulates the sympathetic nervous system, the same one responsible for fight-or-flight stress responses. Instead of entering deep restorative sleep, the body may remain in a lighter, more restless state. Seniors often report waking up multiple times, feeling unrefreshed, and experiencing higher nighttime blood pressure. And high nighttime blood pressure is one of the strongest predictors of future stroke events. Better tip if you love side sleeping, don't curl up too tightly. Instead, keep your body in a more open, relaxed side position with the knees slightly bent but not pulled to the chest. Place a pillow between your knees to maintain hip alignment and a small, firm pillow under your neck for spinal support. This reduces artery compression and allows the lungs to expand fully. For added protection, try to alternate sides. Always sleeping on the same side can cause uneven strain. With these adjustments, you can keep the comfort of side sleeping while reducing the hidden stroke risks. Number 2, sleeping upright in a chair or recliner. Many seniors drift into this habit without even noticing. Maybe you fall asleep watching TV in your recliner. Or perhaps you intentionally choose the chair because lying down feels uncomfortable due to back pain, reflux, or shortness of breath. At first, it might seem harmless. After all, you're still resting. But sleeping upright, especially in a chair, comes with a cascade of hidden risks that are particularly dangerous after 60. The most serious concern is circulation. You remain seated for long hours with hips and knees bent. Blood flow slows dramatically in the legs. This can lead to deep vein thrombosis, DVT, a condition where blood clots form in the veins of the legs. For seniors, those clots can easily travel to the lungs or brain, triggering a life-threatening pulmonary embolism or an ischemic stroke. This is the same risk that makes long airplane flights dangerous, except in this case, it happens night after night. Another issue is neck positioning. In recliners or chairs, the head often falls forward or tilts awkwardly to the side. This position compresses both the airway and the cervical arteries. I've seen patients who routinely fell asleep in their recliners and woke up with sudden numbness or weakness. In one case, a 75-year-old man suffered a mini-stroke that doctors directly linked to prolonged nights of sleeping in a chair with his neck bent forward. It wasn't his blood sugar or his cholesterol that triggered it. It was posture. Sleep quality is also severely compromised in this position. Because the body never fully relaxes, the deep stages of sleep critical for brain repair and memory are often skipped. Instead, seniors experienced fragmented, shallow sleep that raises nighttime blood pressure, impairs glucose control, and accelerates cognitive decline. Research in sleep medicine reviews has shown that poor quality, fragmented sleep is an independent risk factor for dementia and stroke. Add circulation problems on top of that, and the risks multiply. Even digestion is affected. Sitting upright for hours puts constant pressure on the abdomen, worsening reflux and bloating. Seniors who already suffer from GERD find their symptoms intensified, which not only disturbs sleep, but also increases the risk of microaspiration into the lungs. Over time, this repeated stress can contribute to chronic inflammation. Another driver of vascular disease. Better tip: if you occasionally nap in a chair, don't worry, short naps are fine, but avoid spending the entire night there. If you absolutely must sleep upright due to medical issues, make adjustments, elevate your legs with pillows to improve circulation. Use a neck support cushion to prevent forward bending, and set a timer to remind yourself to shift positions. Even better, try to recline at an angle closer to lying flat rather than sitting fully upright. And, whenever possible, transition back to a supportive bed setup. Your brain, heart, and circulation depend on it. Number 1, sleeping flat on your side with your neck twisted. This is the position that shocks most seniors because it feels so common, so harmless. Many believe side sleeping is the healthiest way to rest, and in moderation, it can be. But the hidden danger comes when seniors spend the entire night flat on one side, with the head twisted on an unsupportive pillow. Over time, this creates the perfect storm for a nighttime stroke. Here's why. When you lie fully on one side, the weight of your body presses directly onto one shoulder, collapsing the space around the blood vessels and nerves. In younger adults, this might only cause tingling or soreness. But after 60, arteries have often narrowed from decades of wear. This pressure can reduce blood flow to the brain by as much as 30%. Now add a twisted neck, something that happens when the pillow is too thin or too thick. This forward or backward tilt pinches the carotid arteries, which are already fragile. In seniors, the result is a significant restriction in blood flow. Night after night, this posture can starve parts of the brain of oxygen. Setting the stage for microstrokes or a major ischemic event, I once treated a 74-year-old woman who had always been a side sleeper, curling on her right side with her neck bent. She woke up one morning unable to move her left arm. Scans showed a clot in her middle cerebral artery. She had no history of smoking, no diabetes, and normal cholesterol. The cause wasn't lifestyle, it was compression of her neck vessels. During sleep, the tragedy is that it could have been prevented with simple posture changes. Another overlooked danger is what happens to the airway. Side sleeping with the head tilted forward or back narrows the upper airway. For seniors with even mild sleep apnea, this can trigger prolonged drops in oxygen saturation, sometimes lasting over a minute. During these dips, the heart pumps harder, blood pressure surges, and the fragile blood vessels of the brain are stressed to their limits. Research in the Journal of Clinical Sleep Medicine shows that seniors who spend most of the night in this position have significantly higher rates of nocturnal hypertension and stroke compared to those who alternate positions, and it's not just blood vessels. Nerves suffer too. Constant pressure on the same shoulder and hip leads to chronic pain, joint damage, and restricted mobility. Seniors often wake up stiff, thinking it's just age, but what's really happening is prolonged nerve and joint compression. This not only steals comfort, but also reduces activity during the day, and inactivity is one of the strongest predictors of stroke. Better tip: if you love sleeping on your side, and many do, the secret is in alignment. Use a medium firm pillow that keeps your head in line with your spine, not tilting forward or backward. Place a pillow between your knees to keep hips balanced and shift sides through the night instead of staying on one side for hours. If possible, invest in a side sleeper pillow with arm cutouts that prevent shoulder compression. These small adjustments protect blood vessels, preserve circulation, and allow you to keep the comfort of side sleeping without the hidden stroke risks. Remember, it's not the side sleeping itself that's dangerous, it's the twisting and the pressure. Correct those, and you dramatically lower your risk. Every night, millions of seniors fall asleep without realizing their favorite position could be putting silent pressure on their heart, lungs, and brain. From back sleeping without support, to curling up too tightly, to the seemingly harmless side position with a twisted neck, each posture carries hidden risks that accumulate over time. And the numbers don't lie. Strokes remain the second leading cause of death worldwide, and the majority strike people during sleep or in the early hours of the morning. That's why your sleeping posture isn't just about comfort, it's about survival. The good news: awareness is power. With small adjustments, better pillows, proper elevation, and mindful positioning, seniors can transform their sleep from a silent danger into a true healing state. As a brain doctor, I've seen patients regain energy, reduce blood pressure, and protect themselves from future strokes simply by correcting the way they lie down each night. It doesn't take expensive medication or complicated routines. Sometimes, the key to saving your brain is as simple as how you rest your head. So now, I'll turn the question to you. Have you ever woken up with numbness, tingling, or dizziness, and thought it was just age? Could it actually be your sleeping position sending you a warning sign? Share your experience in the comments below. Your story might help another senior avoid disaster. And if this video opened your eyes, don't forget to subscribe for more life-saving senior health tips.